In September, when I was first diagnosed, I had a genetic test done, and the testing came back, and I just got this big green thing that said negative. And at the point in my treatment, I was getting ready to go through chemotherapy and having to really focus on exactly what was in front of me. The only thing that I literally paid attention to on this entire genetic testing was the big fat negative. So it wasn't until last week that I was taking a look at this and had Dr. Vellek and Gloria go over this a little bit more in detail, just so I had a better understanding of what this genetic test was telling me. So there are specific genes that are analyzed, and what they did is do this cute little sheet. I don't know whether you can see it or not, but this is my whole family, both on my mom's side and my dad's side. So they go through, and any cancer diagnosis that were present from your paternal side are noted on here. So I'm a twin, so that's on here, and then I've got my brother over here, and then all of my aunts and uncles on both sides. Now I will say that it helps to really look at my dad's side because he has 8 brothers and sisters, and then on my mother's side she only has 1 brother. So sometimes it's very difficult if you have a small sampling to be able to identify something very quickly. When the more people, of course, you have, the more that you can tell the bigger picture about what's going on from your family history. So I learned a lot just about the different genes that were analyzed on here. So I was negative for any of the BRCAs. They did do testing for Lynch syndrome, which is very common for them to do when they do a genetic testing, as well as any of the genes for ovarian cancer. So that was one of the things that came back, that I was HER2 negative. So for my breast cancer diagnosis was estrogen or hormone fed. So I was estrogen positive, progesterone positive, and HER2 negative. Whew, that's a mouthful. So anyway, it is important, no matter where you are in your cancer diagnosis, to kind of really know a little bit more about what this means, because one of the things when I was first diagnosed that we all teased my brother Nick was about breast cancer. So it is not common to, of all the cancer diagnoses, it's not common to have a genetic disposition for it. So most cancers are not genetic. So while my brother Nick could possibly have breast cancer at some point, he has to have his own test. So just because I was negative for the BRCA doesn't mean that he couldn't potentially have it. Now, of course, male breast cancer is very rare in itself. So I'm sure he's fine. There's other things that he will probably go out on, and breast cancer is probably not one of them, although we give him a really hard time about that, and I mentioned that early on in my video. So anyway, Myriad was the genetic test that I did, and it really is just a blood test. So very easy to do. So if you have any questions about, of course, ask your medical oncologist. And there are a lot of teams like Missouri Cancer Associates that have genetic education and testing people on staff that can help go through this and explain to you what these tests actually mean. So anyway, thanks for watching, and have a fabulous day.